Hello, welcome back. We know that the numbers in North Carolina are steadily increasing right now. The state of North Carolina is seeing more than 57,000 cases and roughly 1,300 deaths concerning the coronavirus. We're going to try this again. Joining us now to talk about that recent spike, Dr. Anna Marie Temple. Doctor, can you hear me?
I can hear you great.
Okay, let's get this thing going. Yesterday, we saw the biggest single day case jump in North Carolina. Can we touch on that?
Yeah, I think that there's a couple of reasons. Well, number one, a lot more people are up and around and about and moving and socializing and gathering with friends and families. The second thing is that the amount of people that we're testing has skyrocketed. In March, we were barely testing, anyone for all sorts of reasons, including that we didn't have enough testing. So you had to have all these symptoms in place and risk factors in order to get tested. Now we have drive-through ways of getting tested, so we are just testing alone has increased significantly, therefore capturing a lot more cases. But here's the other thing is that we did not go in quarantine because we're not supposed to get it. The reason we did quarantine is because we are all going to get it. Majority of us are going to get coronavirus. We just didn't want all of us get it at the same time and overwhelm the medical system.
Yeah, I remember that being a major part of the conversation initially, and also wearing masks too. But I'm seeing less people wearing the mask. Of course, this is kind of divided people. Is this mask mandate going to be the thing that we need to hopefully enter into phase 3 in North Carolina?
At this point, it can't hurt. I mean, it can, in small children and in the youngsters, there's a certain way of dealing with the mask, which I'm actually going to be talking about tomorrow. But having the mask for the people that are high risk, it can help them. And at this point, we're trying to reduce the spread of the virus at the same time in people that are high risk. Do I think that, if you're asymptomatic and have no symptoms, do you need to wear a mask? Not necessarily. It doesn't matter. It's a mandate. Put it on, move on. This is doing it for the community so we can help one another not get sick at the same time. And for the people that are vulnerable, there'll be enough hospital beds so they can get the help they need.
Concerning people with underlying health conditions, can people with health issues with COVID survive if they catch it?
Absolutely. The mortality is not 100%. Somehow along the way, we've gotten this message that you get COVID, you die. It's not. I pulled some numbers that, if you're 80 years and older and if you have chronic underlying medical issues, your mortality is up to 50%. When you're 80 years old, and if you are 30, your mortality is 3%. But if you have no medical conditions, is 0.1%, which is just like the flu. So we need to get out of our head that just because you get COVID, that you're going to die. That is not the case.
Yeah, oftentimes we hear the worst case scenarios and the exceptions. Thank you so much, Dr. Temple, for taking the time.
It was great to be here.